What would be a significant finding to tell you it's posterior? Yeah, that. What about the coronary sinus that's in the back?
Yeah.
That's a good landmark, right? And then you can see the pulmonary veins coming in directly into that left atrium. So that's the back, or posterior. This is anterior. The heart sits in the chest on an angle like this. This is the apex at the bottom. This is the top. And then this is what coming up?
This is
Ascending aorta. This is the
superior
vena cava coming down. This is the inferior vena cava coming up, right? And then in the back, this is the coronary sinus. These three go into the right atrium, right? That's your right atrium right here. What are these here?
It has to be the left atrium.
These are the pulmonary veins coming into the left atrium, right? Separating the atrium from the ventricle is this sulcus, the coronary sulcus here, right? So you have this coronary sulcus separates the top and the bottom, and then separating the left and the right is the interventricular septum. It's not very clear on this model. So now you have the anterior, this is the right cardiac artery, right? This is the left cardiac artery, forming the anterior interventricular artery, and the circumflex artery going around the back. Okay? Great cardiac vein, right? Right cardiac vein, I believe this is, coming up, right? And coronary sinus in the back. Okay, so now on each atrium you have auricles that kind of come off like the dog ears, auricles. Then let's open up the right atrium. Looks like somebody taped this together. Open up the right. Let's do it this way. Won't open. All right, let's just open it up this way then. So we're taking this open, and you can see this is the right ventricle, right? And you can tell it's the right ventricle, number one, because the blood flow comes back up through this pulmonary trunk. And this is the pulmonary semilunar valve, prevents backflow. These are the chordae tendidae. This is the papillary muscle right here. This represents the trabecular carne, how it's kind of like trabecular-like, trabecular carne. And then this is the left ventricle over here. Let's open that one up. This is the left ventricle here. Notice the wall is thicker compared to the wall here. See how thin the wall is there? This is a thick wall. Trabecular carne. Papillary muscles connecting to the chordae tendidae. Now this valve on the right is the tricuspid. It actually has three valves, three flaps. This valve on the left is the bicuspid. It only has two flaps, otherwise known as the mitral valve. And these valves are connecting the atrium to the ventricles, right? So when the atrium contract, it goes down through these valves. When the ventricles contract, those valves snap shut. The chordae tendidae help to guide wire the parachute so it snaps up nicely. If you have backflow from a chordae tendidae up into the atrium, it would cause regurgitation into the heart, and it's very common to have mitral valve regurgitation. People get that. And then that could cause a really serious problem, could cause mitral valve prolapse, where the actual valve prolapses up, and that may need to be corrected with a valve correction, or surgery, replacing that. So you have your right atrium. If you open up the right atrium, I hope I could do it. It's not letting me, but I'll do it. The right atrium, you can see the tricuspid valve, three flaps. The pectinate muscles, that's the pectinate, whereas in the ventricles it was called what? Trabecular carne. You see the fossa ovale right here, the remnant of the foramen ovale from birth. And then you see the superior vena cava coming down, inferior vena cava coming down, and you can't really see an opening here. Well, maybe this is it. I'm not sure. Either this is the fossa ovale or this is the opening of the coronary sinus, either or. I think that's the fossa ovale here, and this is the opening of the coronary sinus coming in. So the white would probably be the fossa ovale. Okay, so now you have in the left ventricle coming up through the semilunar valves, the aortic semilunar valves going up through the aorta. The It doesn't show it very well on this model. Maybe on this model it'll show it better. Probably does. Here's the left ventricle. Aortic semilunar valve is going to go up through the aorta this way. Didn't show it that well. Let's look at this other model over here. Can I get that? Can you just get that model there? Again, same thing, so we know front from back. Look for that coronary sinus in the back. Also, the aorta, when the aorta comes up, let's look at this. This is the left ventricle, right? Correct? And the right ventricle will be on this side. This is the septum between the left and the right ventricle. This is the coronary sinus. A coronary sulcus separates atrium from ventricle. This is the right ventricle with its auricle. And this is the left ventricle with its auricle here, and the pulmonary veins coming back in here. If I take this open, let's see what we got. Okay, now, this is the right ventricle. This is the right pulmonary trunk with its semilunar valve. This is the left ventricle. Look how thick the muscular wall is. And then coming up, right there, is your aortic semilunar valve, and it's going to go up through here, the ascending aorta. And then the aorta has branches. This one is called the brachiocephalic, goes to the right side. This is the right common carotid. This is the right subclavian. And notice the aorta now goes down behind the heart as the descending aorta. In the thoracic area, it's called the descending thoracic aorta. In the abdominal area, it's called the descending abdominal aorta. That's your main flow. Now, it doesn't show it here, but the coronary artery supply is coming from the first branch off the aorta, right around where it originates, where the aorta starts to come up and emerge from the heart itself. There's a branch coming off that gives you that right coronary artery and then the left interventricular artery. Very high pressure. It's where the pressure is the highest. Right? What else? Any other questions on this?
Yeah. What did you say separated the ventricles again? Outside?
The coronary sulcus. They call that the coronary sulcus.
No, I mean the ventricles.
Oh, interventricular septum. Interventricular septum. That's it. Anybody have any other questions?